Music and dance are central to Kathy Simmonds' life. As a fourth-grade teacher at Steinsville Elementary School, she brings this love into her classroom.
My life has had dance and music in it ever since I was a young child, and I actually started in dance when I was about 4 years old. Dance has always been a part of it. I incorporate music and dance in my classroom. Even the boys who don't like to dance, who say they don't like to dance, will end up getting up in the classroom and dancing with us because it just makes learning so much more fun.
Outside of the classroom, Kathy likes to maintain a very active lifestyle, keeping up with her 4 grandsons, swimming, and playing golf.
I like to stay active. It just makes life more fun. I take any kind of aerobic classes, kickboxing. I love Zumba. I will go to any type of class that has dancing in it just because I love it so much and it makes exercising so much fun. I hope I'll be 90 years old and still keeping in shape and dancing.
Her dream was put in jeopardy in the fall of 2010 when Kathy started having pain and a heavy feeling in her hip.
I started limping. I could not walk with my legs straight. I couldn't do a normal walk. The people at school, they knew me as a very active person, and they thought that I could see the looks in their faces that they felt sorry for me because I couldn't continue my normal activities.
When the trouble with her hip started affecting Kathy's quality of life, she went to the orthopedic surgeons at Orthopedics of Southern Indiana, an IU Health Southern Indiana physician's practice. It was here that Dr. Jonathan Surdam discovered the root of Kathy's problem.
Well, anytime a patient of Kathy's age, and she's relatively young, comes into your office complaining of hip pain, there are certain things that you need to listen for to try and figure out why she's having the pain she's having.
After talking with Kathy about her pain, taking x-rays, and getting an MRI, the diagnosis was clear to Dr. Surdam. Kathy was suffering from avascular necrosis, a condition in which the bony tissue in the hip begins to die because of a loss of blood supply. Once the diagnosis was apparent, Dr. Surdam and Kathy discussed her treatment options together.
So in particular, we talked about the disease process, how long this whole process was going to take, and her treatment options. And she was miserable. Her gait looked terrible. She had a bad limp. And she was just having to really cut back on everything that she was doing because of the pain. So we talked at length about her options, and after we talked through the whole process, she decided that she wanted to have a hip replacement. She wanted to be done with the pain.
Dr. Surdam really actually explained everything to me about a hip replacement. He was very cautious. He didn't want me to make the decision on just very lightly. It's a very serious operation, and he wanted to make sure that I was ready for something like that. I knew the only answer to being able to get back to my normal life and my normal activities was to go ahead and have the hip replacement. So that made my decision.
On May 11, 2011, Kathy came to Indiana University Health Bloomington Hospital for hip replacement surgery. During surgery, Dr. Surdam removed the diseased parts of Kathy's hip and replaced them with an implant that would relieve her pain and allow her to get back to her life.
When I woke up from my operation, I was just really relieved. I felt like I came through with flying colors. I felt really good, and all the worry that I had really just the day before was gone, and I was just so relieved that it was over with. And I knew that now it was up to me to get back by doing my exercises to get back into shape, and I knew that was a cinch because I was going to do it.
Kathy's surgery went very well, and she began the rehabilitation process in the hospital with therapists from the Orthopedics and Sports Medicine team at IU Health Bloomington. Kathy then continued the work at home on her own, as well as with the therapist at Orthopedics of Southern Indiana.
Kathy's doing great. She was only in the hospital for 2 days following her hip replacement. She only required pain medication for 5 days. And at 4 months, when you watch her walk, you can't even tell that she's had a hip replacement. She has no pain. She really has no limitations or restrictions, and is doing very well.
I've just had such a positive experience. everything went the way it should go, and I just feel very positive about Dr. Surdam, and he's the one to go to. After my operation and I got home, I was just so determined to get back into good shape, back to my normal life.
And that's just what Kathy has done. She's now back to school teaching her 4th graders and preparing to choreograph the school's holiday program, and is able to keep up with all of her grandsons. She's back to enjoying her life.